Metro organizer with the Metropolitan Interfaith Council on Affordable Housing. I am one of your class co-presidents, and Scott Olson with Nutrax is the other one. Just this morning, I had the MICA Northeast Roundtable, or a Northeast virtual bus tour, as we were spending most of our time talking about buses. I realized that we start almost everything at MICA at 5 minutes after. And so my apology. It's like Zoom, it takes a little bit of, somebody's got to find the link, and your phone's dead. You got to go flip open the laptop. But I am happy to be kicking off the last of our this year's Lunch and Learn groups. We have had a series of 4 of them as we've tried to figure out what we can do with class during COVID. Class for 3 or 4 years ago developed the 4 focus areas being housing, transportation, dementia-friendly, and age-friendly communities. And so we've tried to hit one of each of those in our Lunch and Learn. Lynn Ammon and Carolyn Claver from Second Half with Ling Limston are our Lunch and Learn presenters today. And they will tell us what we need to know, I believe. Take it away, Lynn and Carolyn.
Yeah, thanks for the invite. I'm happy to be with you all today and share a little bit about what our organization's doing, some tips for you generically to educate you about dementia and things that you can do both within your workplace. And then we also have, our goal is to connect you maybe going forward as you start to put thought to this, how this might be something that you can then bring back into where your areas of work or any other groups that you're attached to sort of move the information forward and expand it past just our time together today. So I'm going to, sorry, Carolyn, do you want to?
I'm just wondering if I can be the host for long enough to do the PowerPoint and such.
Thank you. Yeah, that's totally neat.
And Lynn, talk away.
Yeah, so I am, like John said, Lynn Ammon. I am a social worker by trade. My role at Second Half with Ling Bloomston Community Services is coordinating wellness, our evidence-based wellness programs. And so do that both in the Northeast Metro and the Como area. We're running a Matter Balance program right now at Redeemer Lutheran, Powerful Tools for Caregivers, runs every quarter, and then our Living Well with Chronic Conditions class. And Carolyn Claver is a nurse by trade. She's an RN by trade, and on our staff, she serves the role as the community dementia specialist. And you've got a resident expert here, folks. I mean, I just want to say it. Anytime I have any personal, professional question about this disease and how to support it and learn from one of our community experts, Carolyn is that. And so thrilled that we're going to share what we know with you today, but that more for you to just know going forward that our organization does bring to life all that supports people on the dementia journey. So with that, I think we have prepared a PowerPoint that hopefully will travel us through some of the things we think would be helpful as we delve in, and we will have time for questions at the end. So as a whole, we've all heard the term dementia friendly. We're gonna break this down a little bit and narrow it in dementia friendly Minnesota. So we're all residents of Minnesota at this time. And then go even further. So there's a movement, you'll see a video in a minute here about dementia friendly Minnesota, but how do we become dementia friendly at work? And as professionals, that's how we're gonna scope this presentation today, because we're all kind of here as professionals in this through class. So our video is gonna kick it off. What is the value of creating a dementia friendly community?
More than 5 million Americans are living with Alzheimer's disease, including 91,000 here in Minnesota. And these numbers will soar as the population ages and more people are diagnosed early. Today, an estimated 58% of older adults with dementia live at home. And of those who live in the community, 25% live alone. And while they may receive support and resources from the Alzheimer's Association, they face living in a community that lacks dementia awareness and is unprepared to support them.
There's a quote that says, "Do not cast me out in my old age." As our loved ones are aging, we have an obligation to care for and to treat people with dignity and respect and to help them to be integrated and to be part of our community.
Minnesota is leading the way one community at a time through our work on making communities dementia-friendly.
I believe that a dementia-friendly community is a community where people have an understanding of the warning signs that people might exhibit when they have dementia.
Well, to me, a dementia-friendly community is one that really supports the person living with the disease and then really the family or any of the active care partners.
A dementia-friendly community is informed, safe, and respectful of individuals with dementia.
It's a form of dementia that touches every community.
They are prepared to support them effectively and be a part of the large-scale social change that can transform the face of Alzheimer's and help people live their best with dementia.
We want to make sure that our community learns as much as we've been learning so that we can have a greater impact in our community.
You know, I think some people are frightened by individuals with dementia. They don't understand what's going on. Why does this person seem so confused? I think if we can educate the general community, the store owners, the people who are out there, the service industry, tell them what it is, what's causing it, why not to be frightened by it.
Whether it's a religious community, a geographical community, it's helpful for everyone.
And we want to inspire those people to be able to have conversations and to care for their neighbors, their family members, and their friends. And if we can't get the community talking about Alzheimer's disease or dementia, or identifying that they are a caregiver for somebody living with the disease, it's impossible for somebody to move forward and get the support that they need.
She still has emotions. She still feels love and pain. So the most important thing is we have to get educated as a community.
Through our partnership with Act on Alzheimer's, a volunteer-driven statewide collaboration transforming Minnesota's readiness and response to Alzheimer's disease and other dementias, we've set out to make each of our communities dementia-friendly, providing the essential resources, expertise, and project assistance communities need to better understand and better support their neighbors with dementia.
Act on Alzheimer's has a toolkit to help communities get ready and to begin the process of becoming dementia-friendly. And it's a 4-part phase: convening your community, surveying your community, analyzing your community, and then acting together to create and implement some kind of an action plan.
Understanding at the professional level, where firemen and police officers and medical professionals touch the lives of our elders with dementia.
Spiritual support, which really falls under the meaningful engagement goal, and looking for ways for people who have the disease, who are not living in a formal care setting, to be engaged.
I mean, that's ultimately our goal, is that everyone in the community will know how to identify dementia symptoms and know how to respond.
We've gotten a group of people who don't usually work together on a committee to address these things, and everybody has brought their own skills and abilities and talents.
We could see the huge need to provide support in this specific area to the Latino community.
And you'll hear many stories from communities about the great things they're doing, whether it's outreach to youth, about educating them about the disease, perhaps it's law enforcement education.
And in St. Louis Park, we trained all of the police officers. And the day after the training, one of the police officers called and said, "Who knew how important this training would be to me?" She was called out to a nursing home, and the staff at the nursing home was having some struggles of trying to get residents to calm down. And she said she walked in and she knew exactly what to do. She got down on her knees, so she was at eye level. She called the person by name, took her hand, and gently tried to coax her into coming with her so that she could remove her from an explosive situation. And she said that she just could not have ever done that had she not gone through the Dementia Friends training.
Currently, more than 43 communities in Minnesota, towns and cities, ethnic communities, faith-based groups have made the commitment to become dementia-friendly, and in the process, our state has sparked a nationwide movement, Dementia Friendly America, that will replicate the effort in communities across the country.
The whole Dementia Friendly America initiative really began here in Minnesota, and building on the incredible successes that have happened in Minnesota, leaders nationally took interest in this and said, we need to take this nationwide.
I've been really proud of the work that we've been doing in Minnesota, and it really is a movement that's taking on across the country.
It's had a huge impact.
And it just continues to grow.
And I'd like to just keep pushing to see those ripples go out further, because it's not going to go away. It's going to get bigger and bigger and bigger. This is a huge opportunity to train the future healthcare providers so that they come out of school prepared to address some of those needs.
It's really been a privilege to be able to work with the Alzheimer's Association, to be able to have the support to help us move forward with this work.
And as we raise awareness through our ACT initiatives, the Alzheimer's Association is always there.
They're really empowering us to do it by ourselves as much as possible. That's the way it needs to be done.
Our vision is a world without Alzheimer's. Until we get there, we will continue to enhance the care and support for those living with the disease and expand our reach by enabling communities to provide their own unique support. And with your help, Minnesota can stay on the forefront of this transformative work to ensure that everyone impacted by Alzheimer's and other dementias is part of a caring community ready to support them.
Super. So some of you may have seen that before if you've been involved in any of the dementia-friendly work. But Carolyn and I both thought that really gave us the larger scope of how we sit in community right now, how we sit in a state that has successfully informed and educated and brought folks along to expand past healthcare providers, memory care centers, physicians really into the community. And I think that's what we're all coming hopefully to share today, how you can customize this for the people that you come in contact with, how we can build this into. So we wanted to share a little bit. We'll have an opportunity to reflect at the end, but we'll move into some of our content now to share with you more about what specifically is the disease and how it can, just some tips for you to know as we move forward in the presentation. So Carolyn.
So I just want to bring out the 10 signs. In my almost 2 decades of work just with dementia folks, these 10 signs go beyond Alzheimer's. There's other dementias that show up in these symptoms, and they may not be familiar. People may think of dementia as memory loss, but actually it's much bigger than that. So it really pays to be aware of this. And I know I emailed Lynn a document that is Know the 10 Signs, and you may have all received that, but I enjoy that document greatly to share with families or people that are concerned, because it has lines that allow people to write down symptoms that they have seen so they can show to the medical team. So just, of course, memory loss, memory changes is one of the things we might expect. But what we're looking for is not when you and I later think of what we were trying to remember, but these are memory changes that actually disrupt the person's life, whether it be work life, home life, social life. And so that is a key piece to this. They also then have challenges in planning or solving. So they may be used to multitask with their job and now can really struggle with getting through what was familiar with them before. The next is the difficulty completing those familiar tasks. And, you know, all of us go through a lot of problem solving every day. And this becomes something that is definitely marked in our folks with early dementias. Confusion with time or place. I know some of us that since COVID, the work balance has changed with working from home possibly, and it does mean that we have to think a little more as to what day of the week we might be on. However, this is broader than being able to problem solve to figure out what day it is or the time. Trouble understanding visual images and spatial relationships. I want to point this out. One of my participants in years past was a professional psychologist, incredibly bright man. And his first symptom was he couldn't judge distances. So imagine him behind the wheel of a car. If you can't judge the distance to the car next to you, to the stop sign. So that's a key one, is those visual images and spatial relationships. And his memory went on to be fine for quite some time. The next is new problems with words in speaking or writing. And again, this may be where the symptoms begin. Another participant that I had was a very successful lawyer. And his early symptom was he lost the ability, because his brain changed. He lost the ability to find words for speaking as well as for reading and writing. So that may be early on, no memory changes are going on. The next is misplacing things and losing the ability to retrace steps. So like you and I think of something at the washing machine, we go back upstairs and we think, now what was that? And we walk back down to try and jar our memory, and then it comes to us. Our folks with the dementia are not able to do that. The decreased or poor judgment, I definitely saw this with my father after his stroke. The things that he would not have done before his stroke. So my mom had been disabled since age 63, and he had her driving again after 15 years. So poor judgment is another one. Withdrawal from work or social activities, we definitely see that with folks that are trying to get their world managed, and so they withdraw more and more. And lastly, we can see people with changes in mood and personality. That can affect any of the dementias, but we see it more in frontal temporal dementia, in the lobes that are towards the front and side of the heads. So I think if you're all interested, we can make sure you get that 10 signs sheet that goes into more detail.
We'll email that out to you. And it does give descriptions of each one of those. So it's a great tool.
It also tells what's normal. And I think that's important for people, rather than everyone getting concerned. It shows what's normal.
That's right. Or if you have concerns about coworkers, family members, people you have in your social network, it gives you somewhere to reference, maybe to even create a space for dialogue. That's a helpful tool in that regards, with concerns versus just keeping them to yourself. It's something to reference per se, to start a to spark a conversation. So this is a visual of something right off the Minnesota Dementia Friends, the Act on Alzheimer's website. And we thought it was important. I think some of us have seen it in the past, but I think it's important when we think about where we sit in community. We may all work for organizations that serve seniors, and because we're part of class, that's potentially our common thread. But the way that creating a dementia-friendly community needs to go beyond that. I mean, we all may serve people and be more likely to cross paths with individuals and families living with this disease. But first of all, diagnoses are happening earlier, and so we have.
Lynn has froze for a second here.
Yep.
As she was saying, yes, we are getting people diagnosed much earlier, and they are still doing some things in community, even if it is just going to get their groceries, being at worship service. And so we want to be aware and be in communication with and serving our folks that are early in their dementia journey as well. I want to pass this. Lynn, are you there now? Does not look like it. I'm going to go ahead and take you into one of the things that I feel can be helpful for all of you to consider. This is a part of my dementia-friendly faith community training. I was just up at St. Pius and did this training. Nope, I take that back. I was at Roseville Lutheran and did a training on that October 1st. So I'm taking some of that information and trying to help you all think on that. In order to be dementia friendly, There are, if you remember those 10 signs, visual and spatial changes. So a well-lit area means that it would offer the ability for the person with a dementia to be less confused by poorly lit areas. To have comfortable temperatures where you might have arm rests on the chairs that would help people get up and get down from their chair. Have you thought about unisex restrooms? It's becoming more and more important as caregivers may not be of the same gender as the person that needs to use the restroom. So this makes it more dignified and private. Having enough space to walk around if needed during a session or meeting, that can help somebody who's a little bit anxious and needs to get up and move around. Do you have visual information, for example, photos of your leaders or presenters, so that it helps those that might need just a few more cues? How about varying strongly different colors? So if you think about someone who might have visual changes and you think about the change from an upper landing to start to go down for steps, if you have a good variation in that, it makes it safer for these folks. You also want to be paying attention to what it looks like. For some of our folks, it may feel like it's dropping off into water. Depending on the look of it. So just to be aware of your different colors. Also, have you thought of assisted listening equipment or microphones? And I think, like myself, I speak quite loud, but do we use microphones enough to help our folks to, I don't know if you're aware of this, but one of the things that actually is linked to a dementia is having hearing issues as well as having vision issues. If you aren't hearing to take in your cognitive stimulation, your brain is less stimulated, is less able to keep growing and staying strong. The same with vision. And so if we want to take care of it on the healthy end of the brain, as well as for those that have started into a dementia, we will consider microphones and assisted listening equipment. Clear signage, again, with contrasting colors and simple images. Everything we can do to help keep things simple. And one of the pieces that seems to be two really obvious pieces for me is A, do you have it clearly marked where the restrooms are when they arrive? And do you have it clearly marked where they need to go for your meeting? The next is, have you created a space for personal conversations? So I want you just to think about this. It doesn't need to be a big space, but is there somewhere that a caregiver or a person, maybe the person does not have a caregiver, but can you step out of the flow of heavy activity at your work into a more private space to visit with somebody who maybe is struggling a little bit with the details of the day? And then an access to an outside space to relax. Our folks can get kind of keyed up easily if they feel like everything is coming in on them. And so is there a place for them to catch their breath? It may not be an outside garden space, but is there a bench that they can go to and sit outside of your place? Okay, Lynn, I'll let you take the next one.
All right, I'm back. So perfect. Don't know where I got kicked out to, but appreciate that I'm back. So in looking at that other visual, I don't know, do we want to go back to that? Do we want me to, did you go through it already? Because
I did mostly.
Perfect. So it links to this slide. And so what I mean by that is I was starting to create space to think about the fact that even if we are resident experts, those of us that serve people in our job, the reality is we all live in community, and we can start with our workplaces maybe to develop how do we become more dementia friendly? How do we understand as a team of people that serve a community, maybe it's not our day job, but we are going to interface with family members or loved ones, or even our coworkers who have this going on. And so what we can do to support, there's two ways that really in our state that we can support those, upping just a 1 hour of our time to become more knowledgeable about how to interact with. And it's not about becoming an expert. It's not about now you're going to become the person that people call, but it's going to be where you touch point. You may know a little bit more to be able to then give the information to those people to stay connected, to feel supported in community. So this first site that Carolyn pulled up is really for us as professionals to know that we've got tools for dementia friendly at work. It's a 1 hour training that has there's literally 6 steps. She's now putting her arrows on those. An actual, we don't need to be experts. I empower you all to think about, is this something that you could have as part of your employee training, that there's 1 hour where you deliver this information and this gets out a dementia friendly, and you can actually be the one that delivers it. You don't have to have an expert come in. Nobody has to fund it. It is that simple. And it really is bringing and defining what the illness is and how we can best connect with, educating about how it's really going to be something that we're all going to intersect with. It's not the other or maybe not today. It's reality is this is like as she's going through, but we gave you a touch of it today, the 10 signs and symptoms. This would then be a tool. It's a toolbox, a toolkit of information that you could then bring into an hour-long session with coworkers. You can offer it to the community for that matter. And if it's something you want to add on to your, a reason for community members to walk through your doors, and you're going to present this information to them. It all is an effort to enlighten and improve our awareness of how those with dementia need to be supported to feel part of our community, to feel connected if they're still, because most individuals, and Carolyn, just correct me if I'm wrong, only 5% of all older people are living in a long-term care setting. Really 95% of our seniors are in community. And so we really need to think about that. Even though the number of people in the demographic over 65 is growing, those baby boomers, there's still 95% of that very large number of people in community, because families are getting diagnosed earlier. It's part of the Medicare screening every year now. They actually do a memory screening every year. That's part of that annual physical. People are getting connected. There's supportive programs like ours that are out there. We want to get people connected to earlier. We don't want them to hear, as they're in the middle of a crisis, that I wish I would have known about all this before. So that, I think it doesn't just need to be those of us delivering the service that can support those in community, because it's a spectrum. The journey of dementia is a spectrum. There's no defined really beginning. The end obviously is defined with, end of life, but the beginning is a gray area. And so the closer we can connect and help people feel like if they still want to go to church, even though they don't remember this, if they still want to, go to the bank, if they still want to attend funerals, I'm looking at you, Taylor, really how we can support that, how we can know that. And then when you go through the training, you get a little something to stick on your wall that says you are a dementia friendly space. And I think that that's important. I think if you're a family living with dementia, you're more likely to walk through those doors, and you're more likely to feel like you're going to be supported in that space. So there is the 1 hour training, and then there's also a generic dementia friends, and I'm a champion that leads some of those historically through class. We were working with the school district in offering those. So currently those can all be accessed though online here. Those are happening all the time. If you go to this website, you'll find resources both to deliver it within your workplace, and then also to take the actual hour-long training or refer other folks to it. So
I do want to encourage folks to really help advocate for this in your community. If you think about our communities today, we're not the communities we were 50 years ago.
Right.
We don't have a lot of the adult children living in the same community. So we need to take ownership of our neighbors. We need to If we don't know their children, maybe you know their congregation and you can have a conversation with a pastor or whatever to try to connect with concerns that you have. Excuse me, Lynn. Thank you.
Oh, that's great. Do we want to move? Do we have, I'm just trying to remember. Yep. So this just gives a little description for us all. A dementia friend learns a little bit about what it's like to live with dementia and then turns that understanding into action. Like we saw in the video, it's a growing network of people creating dementia friendly communities together in neighborhoods. It really can fit anywhere, which is the beauty of it. Anyone can be a dementia friend. Anyone can be.
Including confirmation classes, classes at school, Girl Scouts, etc.
Youth groups, any of it. It's the better. Sometimes they're more, and so this is how their website sort of looks. We just wanted to orientate you to, there's an actual link to the 1-hour training, just to generically, and how to, if you're going to host one, how to download a flyer to get that session going. So we want to encourage you as professionals to think about how this might scope within your organization, but also personally an opportunity if you want to expand your understanding of what they teach in this class is so basic that you actually walk away feeling like, I actually feel like I could carry there's no expert needed to be able to meet people where they're at. One of the things that I've repeated very often, and it is taught in this training, and I'm just going to share it here, that I have heard such amazing feedback every time I share it. When you have, very often with dementia, the very last part of the disease that affects the brain, very often the part of the brain that's affected by the disease, the last part is the part of emotions. And so if you can connect with someone in time, emotionally, it's not about what you say, it's not about how you say it, it's just you're going to connect with them in that moment, how they feel emotionally. You will gain and garner all success with that exchange, because that is what is their most competent area of functioning, is how their emotions are feeling. So if you can connect with, and I'm seeing this happen with my own mom, if you're willing to connect with her emotionally, she will actually recall who you are the next time you see her, because you were willing to be in that space with her, whether it was sadness, whether it was joy, whether it was confusion. That is something that and Carolyn can probably put the expert scope on that, but it is real, and it's taught in the class. It's taught, really they do some beautiful visuals with how that is. And so it gives you that feeling of, oh, that's something that I can do. That doesn't mean I have to become an expert on dementia or the disease. I can just be in the moment with someone. That grants us some permission to maybe create space for a comfort having those exchanges with those living with dementia.
So what Lynn was referring to is called emotional memory.
Mm-hmm.
And we don't know exactly how the science of it works, but emotional memory does make it into long-term memory, or can make it into long-term memory. So Lynn was right on there. I do want to talk a little bit about us with Second Half with Lynn Blumston. We have a very strong, very knowledgeable team. One of the parts of our small team, but very strong team, is caregiver services. And with that, it's giving free resources and support and education to caregivers. There are parts of it that are of cost, and that would be if there's more in-depth education and support through a program called REACH, R-E-A-C-H, for caregivers. We also have dementia enrichment programs and respite. The one that White Bear Lake has up in White Bear at St. John in the Wilderness is the Gathering Group Respite for people in early to mid-stage dementia that gives their caregiver a respite while giving a cognitive stimulation and socialization to the person with dementia. We also have, since COVID, started an online one that only lasts an hour, because that's about all you can get out of a person's attention span on Zoom. From a person with dementia. And now new this year, I've started a program called Memory Collective, and that is for people who might have been diagnosed with mild cognitive impairment. They may not go on to a dementia, but they may convert into a dementia, and others that are early in that journey. The coaching and counseling piece is something that I think that is important for you to hear, to give, we want caregivers to gain our trust and have the opportunity, whether it's through that reach coaching, but also Lynn is just about to start the Pearls coaching / counseling, which is very, very important. We don't have enough counseling psychologists out there. If we can get our caregivers and our seniors into that support through Pearls, PEARLS counseling or coaching that Lynn is trained in. The other piece that we do is community education, and that is the Dementia Friendly Faith Community class that I talked about, as well as the 10 tips that I shared for your building. The resources and support is for older adults and caregivers, as well as churches. I work with parish nurses or faith community nurses, as well as the Care Ministry Network. And we have things including support groups. There is one in person now with our group, as well as a couple online through Zoom. There is that daytime respite I talked about, that referral and resource program. So caregivers can just call us for what are my options, and then the educational opportunities. So why would you refer to us? I should back up a second. The educational opportunities includes a lot of what Lynn is doing as well with Matter of Balance and the powerful tools for caregivers and just so many good programs in education. So we have quite an expertise with staff that are well versed in dementia. We've received national and state recognition for our work. And we serve a dementia continuum. So to help you think this through, those with mild cognitive impairment, early stage, middle stage, and then we're serving the caregivers, helping them with resources and support while their person is in the late stage as well. So it's something we have done a lot and did through COVID. We were very busy during that time too. You can get more information on all that we offer at the Lingblomston website under Community Services. But also you can contact us through our Caregiver Services line. We have a phone number or an email, whichever is better for folks. And if you rather go through Lynn, that's understandable if you have questions from today. But the general public can get to us easily through that line.
So yeah, so we have Elisa Brown as our caregiver services coordinator, and this will get you directly to her. So if you're looking or running across individuals who need more information, could benefit from getting connected and support, just feel free to send them right to her, because that is clearly the best way. Then she will help them navigate. She's a social worker also, and she'll help families navigate through. There's a lot of service options that when you're a caregiver, it's just too overwhelming. So that's the joy of this particular position. She will help families break it down and won't overwhelm them in the process.
Yeah, I think I'd like to add that I don't know if you realize that our caregivers working with someone with dementia actually have very serious health consequences from the stress of this caregiving. It's not just emotional caregiving and verbal caregiving, it's also physical, and the worry of the person getting up in the middle of the night and walking out. I mean, it's incredibly complicated, this type of care. So.
There is growing funding from our state going into caregiver services, because the value is becoming evident that if you can support the caregiver, in staying in community longer, then that would as soon as that caregiver drops and doesn't have capacity, then their loved one is going to be living in needing to be living somewhere where there's a lot more support and financial overhead. So caregivers are saving on resources statewide, but then also they pay the price. And I think that if we can support them, that will hopefully be something that they can do a little bit longer. So we have a growing space now where there is growing funding for that. It's not, of course, enough than what we have waiting lists, and we have programs that we just don't have enough staff even for. So we'd like to open it up to questions. Thanks for hanging with us this long. We appreciate your attention and your interest in this topic.
I know everybody's rushing out at once. Uh, Taylor.
You're muted, Taylor.
Classic. Classic pandemic phrase. You're on mute. I'm just wondering, when you go or when the city starts to initiate this, what is usually the entry point? Where does this get brought? Does it get brought to city staff, or does it come in through council, or what's kind of the route that usually happens there?
So Julia, you're on the call and you can help me answer this.
So I'm just going to mention that it comes for different cities. It comes through all different points.
Yeah, exactly.
Whether it be like, for example, the Jewish services over in St. Louis Park, and then they try to announce it and get the word out in that city to garner more and more information. I work with, and I know Scott has been at some of those meetings with the Roseville Alzheimer's and Dementia Action Team, and their city is very involved as well, including their website. So it comes in different directions, but if you think about something like this, you're usually doing it on top of all your other work. So it really does take a team.
Class had started working with ARP, right, literally March of before COVID. We had a meeting up at Venice Heights City Hall, and we were looking at the initiative because we had some interest from some of the cities, Venice, White Bear Lake, and that is where we were looking to sort of build it, if you will, an age-friendly, going after it more than just the dementia-friendly, but as an age-friendly. And I'm not sure, Ramsey, can you talk a little bit about the work of Ramsey County, Julia, and how that intersection with us up in the Northeast Metro?
Well, so my position, in case nobody knows, or some people don't know, I'm the Healthy Aging Coordinator at St. Paul Ramsey County Public Health. And my connections are usually pretty high up. Like, I'm a dementia friend, but I don't know that much about dementia. Now, if you want to talk to someone who knows a lot about dementia, hit me up and I'll get you in touch with someone. I am the county liaison to class, and I am, that's in the Northeast area. I'm also part of the Dementia Friends group that meets at Carondelet in St. Paul. And we don't have any specific dementia programs going on. Like I said, I think we have I don't know, this part of me thinks that we have a gap, right? That the county's not involved in this. On the other hand, you all are doing an amazing job, and I'm not sure we need to do that. So I'm just keeping track of what's going on and trying to stay in the loop, and don't really have other services to offer. Is that what you were asking, Lynn?
Yeah, I think what I wanted to do is paint the picture of how it looks different based on your community. And I think that's what you're saying is, you as a county person may be involved in some level of that, but it needs to come from the community. That's a unique approach, that the way this is designed. There was some momentum a couple years ago. We had the mayor, Joe Emerson, was like literally pushing us. And as an organization, she put us in front of city. We were presenting to, the council a couple times. There was, but no traction. There wasn't any like, oh, we're going to dedicate some space, time, and energy and resources to this on our current. So without that, as one single organization, we wouldn't necessarily move that. But as a collective group of organizations, if it's determined, we want to go to our respective stakeholder groups and say, we're going to commit to offering 5 dementia friend sessions next year, and we're going to collectively promote them, make sure that we have champions to deliver them, and then also make sure participants can get signed up. It's going to take that did sit in the senior center historically, so that gives you some context. It can sit however we want. If it can be, however, it can just be us. I guess part of me feels like, because it's like a starting from scratch, being that work isn't committed to any format right now, it may take us building the momentum back up individually as our organizations sit And that's not a bad thing, because we were at a place where we were trying to figure out how individual organizations would get behind it. And if you start with delivering the model internally, like we all as, I'm going to use you as an example, Taylor, like we're all of the staff here at Mueller Mortuary is going to go and spend an hour committed to this. And then we're going to talk about it at, it's going to filter in, and then we're going to go to the chamber and say, do you guys want to, because we were actually in partnership with the chamber at one point saying, do you want to offer this to all the chamber members as one of the, as one of the lunch and learns or so that will happen. Just, we wouldn't have to create a whole brand new space. It could be integrated in.
No, I guess what I'm saying is, well, and I don't know if I said this, but, public health, healthy communities, which is the division I'm in public health, does not provide those services, that education, because you all are doing it and a phenomenal job. So there would be no need for us to step in and step on any toes. And public health, and my instincts as an anthropologist, are that it should be that way, right? There should be local groups, then it's grassroots, then it's, I could not, nor would I, go into an area and say, you need to be doing Dementia Friends. So those groups that develop organically, we can then talk about ways that maybe the county can support those.
Right.
I know there's a group in Roseville. That's all I'm going to say.
Yeah. So
I don't know how active they are.
Yeah, well, I would say though, that's a good example of, is there, so let's say that organized itself. We said, there's 5 community, services, not even services, 5 community businesses that want to do this. We would go on, we wanted to show you how easy it was. Literally, you go online, you go through those 5 steps, they provide you everything, and then you decide what you want to do with it. My hope is today is, if this at all sparks any interest in going back, that you would take that time and go back to your respective spaces and think, okay, we can do a better job as an organization, either with what Carolyn presented space-wise, the specifics, and or we become more learned in referring people into the supportive programs that exist, because our paths as delivery models we just didn't know you existed to deliver these types of services.
Well, as a sidebar, just because I'll forget it if I don't say it right now, I would and have been thinking about for a long time bringing in Dementia Friends learning sessions internally to the county.
Right, there you go. There it is. Yeah.
That would make me, that's one of my
start with your own, what do they say, start with your own family, like that's maybe start with your own. And I think that if we can spark that today, then we've at least connected you to the resources. They currently exist. They are we all have access to them.
Yeah, but I don't want you to have any expectations about how long that will take to arrange. Okay.
Correct.
I think we don't want you to feel like this is a dialogue. This is not me saying, now we're going to go back and see how many. We don't have any working relationship with the Dementia Friends initiative. I just know it's impactful, and I know that it makes a difference on all levels. And I do see Shelley's hand is raised. Is that a mistake, or do you have a question?
I do have a question, comment. And it kind of relates to Ramsey County, but and you mentioned Vadnais Heights, that it has been brought to their attention along with Viper Lake, maybe.
Absolutely.
But I'm just thinking about our properties. So we have 100 senior living facilities or cottages, and most of them are single women.
Mm-hmm.
And we find that, and I don't know if it's dementia or not. I'm looking at the 10 stages or the 10 signs. It's a possibility, but we see a lot of paranoia, and maybe that's like a beginning stage. I don't know, but police calls. So the sheriff is called in for whatever reason, but it's not a physical, like heart attack or something. It's something else, like, there's a stranger at my door or something. And So we deal with these things, and the sheriff or the police that come are not recognizing
Right.
signs of dementia. So I can see the need for the county to have an acute awareness of this disease and be implementing it in different facets of the services that they provide to the community. So that when a responder comes to respond to a 911 call or, whatever it is, disturbance, whatever, they can recognize that and handle it appropriately instead of just saying, well, this isn't our problem and leaving.
Right.
And that's really what they do.
Yeah,
Because
and you live in Van Ness Heights, and so your first responders are the Ramsey County Sheriffs, correct?
yeah, I believe so, right?
Yeah, they are.
So
So that's something to Julia, for you to think about, is just how that would impact us. And like, if there's anything I can do to help bring recognition of this to the city of Van Ness Heights, I can do that. There's also the VHEDC, which does monthly meetings. They have a great newsletter that goes out every month, or it might even be weekly. I don't know. It seems to always be in my email. They have a fantastic executive director. There's a lot of people that are part of that organization. But just the ability to, because I didn't know about any of these services before, and I'd never heard of Dementia Friendly before.
We're glad you're here learning with us.
So I'm really excited about that. And then I'm thinking, like, I could provide training to the children or
absolutely
people.
Absolutely.
that
You have a
are
beautiful,
connecting.
you have a community room over there, Shelley, correct?
Yes.
Yeah, I mean, and even if you opened it up to just general, I mean, it's also provides an opportunity for people to learn about your building there and how you, because you're kind of hidden away, you're.
Well, yeah, that's actually okay, because we're full with
I know your waiting list.
really long list. So we can't handle any more interest. But well, our biggest issue is that people end up leaving to go into another facility. And then also just this, paranoia or blaming.
Yeah, Carolyn, can you just talk a minute about that? Because those of us as community providers, that is real. I mean, especially if if the individual is living in a building, like an apartment building or a complex like yours at the cottages, where that, somebody stole my purse or somebody was in my apartment. Those pieces, Carolyn, can you shed a little light on it? Because that was my mom's experience, quite frankly, that is exactly how her dementia presented.
Yeah, so it actually is relatively complex. I think that the communication training you get through Dementia Friends is critical for communicating with anyone, but it really helps to know it for communicating with people with dementia. But once we have people that show signs of paranoia, it takes the medical team to weed out, is this a dementia? Is this something that's related to a mental illness? Or do we have a crisis going on? And it's a 911, get them in because they could die from having an extreme situation with a medication or something that's causing the symptoms of paranoia. So I think you're right that to have your people that are the first responders trained in this is a key piece. And to have the community be aware so they can help be feeders into help. And then the second leg is, do you know enough resources that you could help get them connected to help? Because it's difficult when a diagnosis happens, but then they get discharged to home and there's nothing to help them carry on.
That's right.
I just wanted to respond. I'm so glad. Well, excuse me.
Bless you.
I'm so glad you said that, Shelley. What occurred to me was that while we certainly don't have the bandwidth to coordinate Dementia Friends or other dementia efforts across the county, that just makes me break out in a sweat. I would be glad to work with someone, and I think it's our deal to find folks in local fire departments, in local law enforcement departments, and introduce them to this idea or to someone that could talk then about that idea. I can find those connections. I have a couple, and I certainly don't have a connection with the sheriff's office, but we could see what we can do about that.
Super. You know, they're hungry for it. I am going to say this. After having the sheriff come to my mom's house in Venice Heights there a few times, they want to know more. They really do.
That's
They
awesome.
they just don't even know where to go.
Right.
So I think that you just delivering some of these links could be, you know, it could be their next lunch and learn. It's just, you know, that you got to figure out where it fits with your people. That is the beauty of the way it's designed. It can be that flexible.
So
Julia, sorry.
Taylor, you go.
Julia, the
Although
person
we're nearing the end. Go on.
Oh, sorry. Quick question. The person that you mentioned in the chat, the Dimensions Friend Group that's led by Megan Constantini, is that someone who's coordinating people who are trying to take action in communities, or would she be a good
in
contact?
St. Paul? So the group that she works with is in St. Paul, but again, I'm sure she has a ton of connections to other dementia friend groups.
Think so?
Well, and we're
guessing.
a suburb of St. Paul, so I've attended those meetings as well. It's really trying to network. It's trying to help you get connected with others that are passionate about this. So totally, Megan would be just fine to be.
And connections are everything as far as I'm concerned.
Absolutely.
Relationships.
Is there anything else Carolyn or I could, it's not that we're not available. We are. Thanks, Allie. Good to see you. Just put it in the hopper. Some of the things we presented to you today, think about how it may be something even in a new year, you know, what is your employee support? You know, how are you educating folks? And if it fits to introduce it, to bring it, or maybe you're the one that goes through it and you decide, hey, now I can speak to this a little bit more. How this would impact others as we move into either what we deliver or how we deliver it. I mean, in some communities, you could see in the video, it was the bankers that went through it. It was, you know, the people that worked in, you know, the city hall went through it. I mean, that's the people that have public facing positions that have the best value.
So Lynn and Carolyn, are you able to come out and speak? Like if I had something in our community room and invited families of people that live there and maybe some of the city, the and others that might, maybe someone from the VHEDC. We don't have that big of a space, but.
So like to present the Dementia Friends like content, or when you say speak, what are you thinking of?
Well, I mean, like educate on dementia and also educate on some of the services that are available and answer some questions. I mean,
Shelley, I think for you to email Lynn and then we can get back to you with next steps might be the most conducive for today's time, because we've got a lot of connections.
Yeah.
Okay, that would be great. I'm just saying that this is a really big issue and I think it's great.
Thanks, Scott.
All right, Scott has to go. I have a my mom question that we can officially end, and I could just ask Carolyn.
Thank y'all. You're awesome.
Bye, Julia. Thanks for being here.
Yeah.
I'm curious in the mom question.
Thank you.
Sure, not a problem. So my mom is beginning to have memory loss, and when I said, okay, I've signed you up for an appointment, I'll be there. We're going to talk about early screening, because my wife, the hospital nurse, is like, you need to get your mom in for some of that. And I said, I left the message, and she's like, what is this appointment for again? And I'm like, it's for your memory screening, Mom. Why do I need that again?
Yeah.
And it's heartbreaking.
Yes.
But I also said, she said, well, I don't know if I need it and it might cost, but I'll do it. But I just wanted to let you know, I'm not sure I need it. And I'm like, yeah, you said that the last 3 times we talked. And she's like, well, now it's 4. So love you, Mom. All right, first off, she's in Winona County. So I'm not hooking you all up with all y'all. I know that there's a senior.
Did you see them in the video? They were
Was
in the
Winona
video.
in there?
Catholic
that was
Charities.
Mankato.
Yep, Catholic Charities in Winona is
Okay.
what they're part of Dementia Friends. They're strong.
Okay.
strong.
Okay, so look up Catholic in Winona.
Yep, yep.
What's do you know what early screening I should ask her doctor for? So there is there's like a 10-minute memory test that has been done. There's got to be something more.
So there's a few different things that can be done. Lynn had that 10 signs sheet. I would start making notes on there of what you're seeing the changes to be. So you can draw their attention to what the family is aware of for changes. I would try to get that to the doctor's office ahead of time. When I have done that with my family, I have sent it and said, please do not tell my family member that I informed you of all this, because it's a matter of trust, and they're struggling right now with feeling a little bit of loss of control. And the next thing is if the physician does, you can ask then, please go deeper and see if you can find more basis for a memory diagnosis. Depending on who they are, they may or they may not. Some are a little more afraid. Now, from a smaller community, if they know people in the community, it's harder for them to say it's a diagnosis of a dementia or an Alzheimer's. And then it may require a second appointment with a specialty clinic that deals neurology, that deals in memory care. And with my family, I continually said, we're going in to see a specialist because I need to make sure we can do everything to help you be at your best and living your best. And that's the angle that I took it from. I never talked to them about how often I was seeing problems, because they're so unaware of it. It's just not on their radar. They don't remember. That's all in the short term. And they just don't remember. To them, it's almost like you brought it up for the first time. And gosh sakes, what's the problem here? And I don't like it that I don't notice it. People don't say anything to me. Why are you pushing this issue? So I always tried to spin it as positive as I could, as, you know, we're trying to make sure we get just the best for you all the way around.
We're talking about brain health. I think what I found, if I keep, like Carolyn's saying, if I keep saying we're going to go get your memory tested, that clearly does not bode well.
It's more of a negative.
If we're gonna check on your brain, there's some things that we think we can do to help
keep you at your most optimal.
Yeah, to help you to be available. There's lots available now that we don't know what they all are as a family. So we're gonna learn together.
Right.
That does work.
So John, what I'm going to tell you is, when you know one person with a dementia, you know one person.
Yeah.
Everybody has to be dealt with just a little bit different. I know my dad was quirky and difficult. My mom was easy. Glenn's dad was easy. So but yet you still have to finesse your conversation so that you keep them on your team.
Yep.
I will tell you one thing that's been critical in my work in dementia, and that's a premier educator by the name of Teepa Snow.
Yeah.
Peepa Snow. She's got tons of YouTube videos out there with lots of different education. But what she will tell us is, we are the ones with the brain intact. They are the ones with the brain changing. It's up to us to figure out how to work with them. So, for example, one of the things that she did in an education was she went up to somebody in the audience and got down by their kidneys and yelled, "Come on, kidneys, pee. Come on, kidneys, pee." And then she looked at the audience and the group was just kind of, what are you doing? And she said, well, why are you so surprised? We do that to people with memory loss all the time. We say, of course you know me. I'm your favorite daughter. Of course you know me. Of course you remember what I said. We had a long conversation about it. But it's the reality of it is it's a change in their brain functioning just like the kidney disease, the heart disease, the diabetes. And now we have to figure out, so if you have a time whenever you work with your mother, you find that something put a light on and she was just like, oh yeah, I can do that. You will remember that and use it over and over and over again, because that was the key that turned the ignition on. So when you find a success, make sure, and if you've got siblings or other people that are helping with the care, share those key pieces that work well with her.
Yeah.
It's not cut and dry, John. I wish it
The village.
Yeah, and she had somebody who was coming, so she's mobile on stairs.
Yeah.
Has lower, 82, lower back pain if she stands for long, so she can make it around a block, and that's about it for walking. But the mobile and stairs has led me and the rest of the family to think aging in place as long as possible.
Totally.
But get some kind of services in there. What are the first kind of things that somebody with a little bit of, some cognitive and some physical, but not overwhelming physical problems?
So there are agencies out there that actually sell different tools, electronic devices. So depending on if she has a difficulty with falls, you can actually get some easy tools hooked up to ping your phone when the refrigerator door opens. Then you know she's in the kitchen. Or there's a mat by the bed, so you know when she's gotten up out of bed, or you know when the toilet flushes. So there are tools out there that can help with that. But if you're looking for more complicated, then usually you get an agency to come in. A lot of them are really good in helping, and they'll tell you, well, I can walk you through how to do this yourself.
Yeah, we're both, my brother and I are both in the city. She's in Winona, so we need somebody locally.
So if I were in your shoes, John, I would call Catholic Charities in Winona and just paint the scene like you just did, and then they will help you navigate within that community what typically needs to either get connected to or start a relationship with or get on a waiting list or all those. That's I think going to be your first. There's an active, only because I went to school there, and there's a very active community-based services to seniors down there, and they've been a leader in the dementia friendly movement. They are well organized down there, and they can do it because they're a smaller community, which makes me sad because I wish White Bear was. I know, Taylor. Like my heart is just, it was so, as a community member up here, and now I hear it obviously from Venice Heights too, we're not huge communities either. So it does feel like it's something that we could build and create momentum around, and, get the local bankers and the local funeral homes and the local attorneys. And I mean, they're there kind of, people were starting, I know Sheila Kelly was like, oh yeah, start feeding. I mean, the people were all intersecting with olders with dementia. It's just what we're doing. It's just but how do we do it at our best? How do we create the feelings for family? I mean, it will Stillwater, that model out, I mean, Stillwater is a wonderful model because all of those businesses went through the training, and they all have the little sticker on their thing saying they're dementia friendly, and it just welcomes families in. I mean, it just does that. And then, and you feel like reciprocity, like, well, we want to support this organization, right? Like they're willing to go into my space. So it's a win-win for everyone. And I struggle. I'm passionate. I carried this torch. My son is 24 and has dementia. He has autism. So I was the one that was like, autism become, and there's parallels, right? That how do we still help these folks navigating community without creating fear, and so that the caregivers can feel safe and secure going to those places, because they'll stop going. They'll go to your restaurant if they know they put there's a little purple card that you set there and say, my loved one has dementia. Please be patient or something. If they know that's going to be received, they will go back. And so I just know that we can do better. We can create those spaces. I don't know that we're doing that great as a community. I I feel like there's definitely a room for that to be built, and there's new decision makers and new at the council, city level and all that. So now we've got new players. So these things need to be carried forward. It comes from the people. It comes from, so Taylor, I don't know, are you still on the chamber? Are you still part of the chamber? I just wonder, because I know she was super supportive. We were going to do it. We literally had to cancel it. I know.
Speaking of canceling, I'm going to stop the recording.
Yeah, thank you.